Good morning to all. Thank you, Anshu and KSOS, for giving me an opportunity to present my topic here. So, we already learned about OCT in detail. So, I am going to talk what next, what are the available advancements in OCT. So, the first one is Octa. So, sir already discussed the Octa in detail, so I am not going to go in detail about it. So, basically, we retina specialist after OCT, we want to know the retinal vasculature, what are the abnormalities in the retinal vasculature, and nowadays, rather than ordering an FFA, we would like to do a non-invasive procedures like Octa. So this is a common investigation we usually do in our OPD. So, sir already discussed about the Octa in detail, different machines available, and why we order Octa in why we do Octa more rather than FFA. Like it has a shorter acquisition time. It's a non-invasive procedure, and it will provide both quantitative as well as the qualitative analysis. So the clinical application include the diabetic retinopathy and wet age-related macular degeneration, retinal vein occlusion, and mactal. So it basically will help to analyze the non-perfusion areas, the neovascular bundle, and the foveal avascular zone can be quantified. So we will get an idea about how to proceed with the management. So when we order of Octa, we have to look for the artifacts like media opacity can decrease image quality. The projection artifact can we will get an overlap of the neovascularized superficial and the deep vessels, and the segmentation error in cases like macular edema. When IRF and SRF are present, we will not be getting a proper segmentation of the layers and motion artifact due to eye tracking, due to eye movement. So the recent machine have eye tracking like system, so this motion artifact are less. So coming to the recent advances in currently available technology, what we have now is we have wide field and ultra wide field OCT. Wide field OCT, when we get a FOV of around 40 to 55 degree, and ultra wide field is FOV around 200 degrees. So the presently commercially available wide field OCT machines are the NIDAC machine, which can get up to 160 degree, 163 degree of ultra wide field imaging. Then Heidelberg machine, which is an SD-OCT, which can generate up to 55 degrees. And when this is combined with Storangi lenses, it can get up to 150 degrees. Then the Optos machine, which is an SSOCT machine, which can get up to 200 degrees of field within less than a 0.5 second. So this is an wide field OCT image. So yeah, this basically help to assess the peripheral retinal changes. Like in retinal vein occlusion in the left-sided picture, you can see the retinal thinning temporal to the fovea, and similarly the Octa image also showing the non-perfusion areas in the Octa image. So in the right hand picture, you can see in the peripheral retina there is a hole in the retina with an operculated hole. You can appreciate in the peripheral retina. So wide field OCT, what are the uses? It is basically used in peripheral retina changes, like to look for the ischemic areas in DR and vein occlusion, and look for the site of retinal breaks, peripheral retina detachment, retinal schisis, and also to in evaluating the choroidal lesions like melanoma, nevus, hemangioma, and choroidal metastasis. So the certain challenges are there when we increase the field, that is optical aberrations, which can cause us increased noise to signal ratio. Then we have a pupillary and ciliary shadowing like artifact, due to which further reduce the image quality, and increased peripheral retinal curvature, and there is an inter-individual variation between the patients. So, and when we have to get a wide field OCT, we have to have a very high A scan rate to obtain this dense wide field OCT. So coming to the next is intraoperative OCT, that is IOCT. Intraoperative OCT allows for surgeon to utilize a microscope integrated OCT imaging in real time for feedback and image guidance in the operating room. Two major studies are undergoing, like Pioneer study and the Discover study, to investigate the utility of IOCT in various ophthalmic surgeries. See, basically it is of handheld type is available, and microscope mounted and microscope integrated. This microscope integrated design help to visualize the real-time vitreoretinal interface interaction with the surgeon's instruments, and corresponding changes can be assessed intraoperatively. So this is an example of microscope mounted one, where in the circle you can see the IOCTs mounted with the microscope. So in this case, this is a macular hole surgery, where the surgeon already peeled the ILM, and you can appreciate the ILM flap over the macular hole. The same can be appreciated here. The ILM flap can be appreciated in IOCT in a closing macular hole. So, surgeon can assess intraoperative macular hole closure or identify the remnants of epiretinal membrane during membrane peel. IOCT may also obviate the need to use dye staining during macular surgeries. IOCT may also facilitate the therapeutic delivery of drugs like TPA or the placement of electrodes array for subretinal implants. So, coming to the emerging advancements for clinical use. So visible light OCT, that is now we already learned OCT use a near infrared light. So rather than using near infrared light, here visible light is used to capture the images. When we use visible light, we know the visible light spectrum, that is between the 535 to 700 nanometer wavelength is used. So this is a shorter illumination wavelength. So it will increase the axial resolution, that we will get a less than 2 microns of with smaller bandwidth. So this is an example of visible light OCT. In the left hand picture you can see the visible light OCT, and this is the near infrared OCT. So when we compare the outer retinal zone, here you can appreciate the different layers of outer retinal zone clearly with the visible OCT. When compared to the near infrared, it's already a blurred image type of picture we are getting. So this has got very this is a useful technique actually, but currently it is used to measure the information such as oxygen saturation in retinal blood vessels, and also the distribution of light sensitive pigment, that is spectroscopy. But the limitation are it has got a depth dependent dispersion of the light, thus decreasing the image quality, and also challenges in developing a broad band visible light sources and a relative intensity noise associated with it. So coming to the next emerging advance is the polarization sensitive OCT, that is PSOCT. PSOCT functions by analyzing the polarization state of the backscattered light and measuring its birefringence. So different tissue has different polarization state. So the fibrotic tissue containing collagen is particularly birefringent and thus imaged well by PSOCT. So Schuss et al. Demonstrated that PSOCT is useful for the evaluation of RP changes in the choroidal neovascularization in eyes with neovascular AMD, and the retinal fibrosis growth in the setting of the neovascular AMD can be tracked with PSOCT and segmented algorithms. So this is a picture showing PSOCT. You can hear the normal OCT picture. This is the area of RP atrophy, and in this PSOCT, similarly it can also be documented clearly in PSOCT compared to the STOCT. So the limitation of incompatibility to the commercially available systems, and cross coupling artifact in fiber optics, and difficulty in measuring a true depolarization. Thus, to conclude, OCT technology continues to address the certain limitation observed in current standard of care for choroidal and retinal diseases, and these advancements will help you in advancing the basic science research and our understanding of the pathophysiology of the chorioretinal diseases. Thank you.
Thank you, Shruti, for that enriching